So the top part of the lungs, this part will be the larynx, right? And then on the larynx we have this structure that we need to know. Sorry, this structure will be the thyroid cartilage. Then after the thyroid cartilage, the second one will be the cricoid cartilage. Cricoid cartilage. Then after the cricoid, we have the tracheal cartilage that goes around the trachea, right? And then inside we have the trachea. And then if you follow the trachea goes all the way down to here. Now when the trachea split into the primary bronchi on both sides. So you see, so follow this. This is your trachea. When it splits, one goes to the left, one goes to the right, right? So this will be your primary bronchi. Then when the primary bronchi splits, from the secondary bronchi on both sides. See, primary splits into secondary bronchi. Primary bronchi splits into secondary bronchi. Now if you follow the secondary goes into the lungs and splits into tertiary bronchi. Got it? And then at the end of the tertiary, when the bronchi get very small, they become like this. These gonna be the bronchioles. And then remember for the lungs, the pulmonary circulations. So this will be your pulmonary veins. And then when the pulmonary veins gets very small inside of the lungs, they change into venules, the red ones. And when the pulmonary arteries get very small inside of the lungs, they change into arterioles. Arterioles, the blue one. And then now these, where the exchange for oxygen and CO2 take place, these will be the alveoli.
Alveoli?
Right. Okay. So all of these structures are located inside of the lungs, right? So which is this organ right here. And for the lungs we have two. The right lung and the left lung, right?
Yes.
And the right lung we have three lobes. Superior, middle, and inferior. Lobe.
Superior, middle, and inferior. Okay.
And then on the other one, we only have superior and inferior lobe.
Lobes or lobe?
Lobe. Right. And then the other vessels, we need to know this one. That's part of the superior vena cava. And then after that is this. That's part of the brachiocephalic.
Okay.
Left and right brachiocephalic.
Okay.
And the brachiocephalic, remember, that splits into the internal jugular. And then this is part of the subclavian.
Okay.
Good. Superior vena cava, brachiocephalic. This will be the right brachiocephalic and the left brachiocephalic. Internal jugular, and then subclavian. And then this part, that's part of the aorta. And on the right side, this side, that's the right common carotid.
Okay.
And then after this will be the right subclavian. And then the left side is the left common carotid and the left subclavian. And then this muscle is the diaphragm muscle.
Diaphragm. What about this here and here?
No, that's part of the esophagus. You don't have to know this.
Okay. And that's it?
Yeah.
All right.
So these two veins on top is gonna be the brachiocephalic veins. So on the exam, this will be specific. This one is the right brachiocephalic vein. This one is the left brachiocephalic vein. And now when from the brachiocephalic vein, the blood will go to the superior vena cava. And at the same time, blood that's coming from the lower body go through this one called the inferior vena cava. The inferior and the superior vena cava carry blood to this chamber called the right atrium. Once the atrium contracts, the blood passes through this valve called the tricuspid valve, and then into this chamber called the right ventricle. Again, now when the ventricles contract, the ventricle pumps the blood through this valve called the pulmonary semilunar valve and go to the pulmonary trunk. From the pulmonary trunk, you see the blood will go to these two blood vessels on both sides, this one and this one, called the pulmonary arteries. Right? So from the pulmonary arteries, left and right, the blood will go to the lungs, get oxygen, and then come back to your pulmonary veins on both sides. Right pulmonary veins and left pulmonary veins. And from the pulmonary veins, the blood will go to the left atrium. Now when the atrium contracts, the blood passes through this valve called the bicuspid valve and into this chamber called the left ventricle. And once the ventricles contract again, the blood passes through this valve called the aortic semilunar valve, you see it? And from the aortic semilunar valve, the blood will go to the aorta. And now this part of the aorta, if this to be specific, this is the ascending aorta. This curve will be the aortic arch. This part that's going down will be the descending aorta. And now from the aortic arch, we have three branches, right? This one that's closer to the right side will be the brachiocephalic trunk. This one supplies blood to the left side of the head, called the left common carotid. And this one for the left arm, that's the left subclavian. And inside of the atrium, we have these two structures that's transmit the electrical impulse. They start with this structure called the SA node, which stands for sinoatrial node. And from the SA node, the signal will go to the AV node, which stands for atrioventricular node. And from the atrioventricular node, the signal will go to the AV bundles. AV bundles, you can really see it on the model. And the AV bundle splits into two structures. One goes to the left, to the right ventricle, and one goes to the left ventricle. This structure right here will be the left bundle branch of his, and this one on the right side. Sorry, this is the right branch of bundle of his, and this one is the left branch of bundle of his. And from the bundle branches, these branches that's coming out of it will be the Purkinje fibers on both sides. Bundle branch of his, Purkinje fibers from that. And now between on the tricuspid and the bicuspid valve, so this is the tricuspid valve and this one is the bicuspid valve, right? At the end of each of these valves, we have these structures, the strings called chordae tendineae. You see, chordae tendineae. And now at the end of the chordae tendineae, you see the red part is a muscle that's hold the chordae tendineae to the heart, called the papillary muscle. Same thing on both sides, chordae tendineae, papillary muscle. You see it, papillary muscle. And now where you see the papillary muscle is connected to the heart, these structures, these are called trabecular cornea. Right, got it? Trabecular cornea. And now the blood vessel that supply blood to the heart, we have two of them called the coronary arteries. So one on the right side called the right coronary artery, that splits into the marginal artery. And if you go all the way in the back, if you follow it all the way in the back, that leads you to the posterior interventricular artery. And for the left side, we have the left coronary artery that splits into the circumflex artery. And this one is the anterior interventricular artery. Now for the veins of the heart, the three main ones we need to know is this one called the great cardiac vein. And then this one right here will be the small cardiac vein. In the middle, we have the middle cardiac vein. Now these three veins carry deoxygenated blood into the coronary sinus. Great cardiac vein, small cardiac vein, middle cardiac vein, coronary sinus. And this is it.
Thank you.
No problem.
Okay.
So for the veins, let's start with the superior vena cava and go like this. But
Okay.
remember the direction is from the peripheral and then go back to the heart for the veins.
Mm-hmm.
But we're gonna start from here to make it easier. So we have the superior vena cava, and when it splits into your brachiocephalic on both sides. If they say be specific, right brachiocephalic and left brachiocephalic. Superior vena cava splits into brachiocephalic. And the brachiocephalic, when it splits into internal jugular and subclavian. And on the lateral side of the internal jugular, we have external jugular. And on the back, we have the vertebral vein. Good. Now the subclavian, all of this, split into your cephalic, all the way down, and then axillary, all of this, and the axillary split into basilic, this one, and this one is the brachial in the middle. Now the brachial splits into radial on the lateral side, ulnar on the medial side. And from the cephalic, all of this, and the basilic, This V shape will be the median cubital, and the rest will be median antebrachial. And now this curve on the palm of the hand will be the palmar arches. And now this one will be the intercostal vein. Below the intercostal vein, we have the azygos vein that ends right here. And from the azygos, all of this azygos up to here. And from the azygos, we have hemiazygos up to here as well. Hemiazygos right here. And then from the hemiazygos, we have the accessory hemiazygos. And now at the end of the both azygos and the hemiazygos, we have the ascending lumbar on both sides, ascending lumbar. And now below the white atrium, this big one will be the inferior vena cava. All of this, inferior vena cava. And these little branches from the inferior vena cava, the spikes, will be your lumbar veins. Now the inferior vena cava splits into common iliac on both sides. Common iliac. And each common iliac splits into internal iliac and external iliac. Internal iliac, external iliac going out. Now the external iliac, this one, go over the femur. This is gonna be your femoral vein. And behind the femoral vein, we have the deep femoral vein. Femoral, deep femoral. And on the medial side, this big one, all of this, will be the great saphenous. And now behind the knee, we have the popliteal. And the popliteal branches over the tibia. We have the anterior tibial. Behind the tibia is the posterior tibial. And on lateral to the posterior tibial, this one is the fibular. And next to the fibula is the small saphenous. Now on the exam, if they point to anything at the bottom of the foot, will be your plantar arch, and the one on top for the vein, the top will be the dorsovenous arch. Now for this area, this is gonna be your liver, right? And for liver, think of the word hepatic. If you look at this blue blood vessel that's going towards the liver, the blue one, you see it? Going towards the liver. This one, the blue one. It's going to be the hepatic portal vein. And the hepatic portal receives blood from the spleen, which is this, via the splenic vein. And below the liver, we have the stomach. The word for stomach will be gastric. So this also carry blood to the spleen, to the liver. It will be the gastric vein. And below the gastric vein, we have, after the stomach, we have the intestines, right? For the intestines, we have the superior mesenteric, inferior mesenteric. Superior is on top, inferior is at the bottom. Superior mesenteric, inferior mesenteric. And now for the kidneys, we have the renal on both sides. Renal vein, blue one, renal vein. Sorry. And now for the genitals, we have the spermatic, or you can say spermatic or you can say ovarian. Depends on the gender. If it's a female, it's ovarian. If it's a male, it will be spermatic. And that's all the veins. You wanna make another video for the arteries?
Okay.
Now for the arteries, the main artery, this big one, that starts from here and ends right here, will be the aorta. So from here all the way down to here will be your aorta. Now in the exam, they like to say be specific for this part. This is gonna be ascending aorta. It's going up. And the curve will be the aortic arch. And now when it's going down, will be your descending aorta. So first we have ascending, going up, ascending aorta, aortic arch, the curve. Now when it's going down, will be your descending aorta. Now the descending aorta splits into two. If it's inside of the chest cavity, this section, right above the diaphragm, will be your descending thoracic aorta, because that's the chest. And then once it passes the diaphragm, it goes to the abdomen. So this next section, below the diaphragm, will be a descending abdominal aorta. So descending thoracic for the chest, descending abdominal for the abdomen. And now the descending abdominal splits into common iliac. Same thing for the vein. Common iliac veins. For this one, you just gotta put common iliac artery, the red one. So it's the same name. And then remember we said the common iliac splits into internal iliac and then external iliac, same thing. Internal iliac artery, external iliac artery. And then the external iliac artery branches over the femur. We have the femoral vein. And behind the femoral vein, we have the deep femoral vein. Deep femoral artery, sorry. Deep femoral artery and deep femoral artery. And then anterior tibial artery, posterior tibial artery. And lateral to the posterior tibial, we have the fibular artery. And if you look at the anterior tibial, follow it all the way down over the foot. This leads you to the dorsalis pedis branch of anterior tibial. And at the bottom is the same thing, will be the plantar arch at the bottom. And now this part right here will be the mammary artery. And from the mammary artery, this is gonna be your intercostal veins.
Arteries.
Intercostal artery, sorry, yeah. Mammary artery, intercostal artery. And now from the descending abdominal aorta, you see this branch right here? This one will be the celiac artery. And the celiac artery splits into 3 other arteries. One goes to the spleen, will be the splenic artery. One goes to the stomach, will be the gastric artery. And one goes to the liver, will be the hepatic artery. So celiac is the main branch. That goes to the spleen, splenic, stomach, gastric, liver, and then hepatic. Now for the intestines, it's the same thing. Superior mesenteric artery, inferior mesenteric artery. Superior is on top, inferior is at the bottom, mesenteric artery. And for the kidneys, it's the same thing, renal artery. Now for the genitals, we have the spermatic, or you can say ovarian. Depends on the gender, same thing. You can say either spermatic or you can say ovarian. Now, if you look at the aortic arch, from the aortic arch, we have the 3 branches. One goes to the right. This small section will be the brachiocephalic trunk or brachiocephalic artery. That splits into common carotid and right subclavian. Right common carotid and right subclavian. Now on the left side, this would be the left common carotid, and this one will be the left subclavian. Now the common carotid splits into external carotid and internal carotid. Common carotid, external carotid, and internal carotid. And on the back, we have the vertebral artery on both sides. Vertebral artery. Now the left subclavian branches into the axillary, and the axillary branches into the brachial. And the brachial splits into the radial artery, ulnar artery, and the curve on the palm of the hand, palmar arch artery. And that's it.
That's it?
Yeah. So this muscle that goes around the eye will be the orbicularis oculi. And the one that goes around the mouth will be the orbicularis oris. Orbicularis oculi and orbicularis oris. And on the side of the head, over the temporal bone, we have the temporalis muscle. And over the jaw, we have the masseter. And under the masseter, we have the buccinator. Now, buccinator depends on your teacher. Some teacher mentioned this as the buccinator, and some teacher mentioned the part that's under it as buccinator. So ask your teacher about the buccinator, right? And then from the masseter, you see this one that goes to the, from the zygomatic will be the zygomaticus major. Good. So orbicularis oculi, orbicularis oris, masseter, depends on your teacher. This or this will be the buccinator. And then now for the O1, the mental foramen, we have the mentalis muscle, and that's for the face. And now for the neck, we see this big muscle. All of this will be the yes. All of this will be the trapezius. Good. And under the trapezius, so this once you cut the trapezius, so that's part of the trapezius as well, right? And under this muscle, we have the semispinalis.
It's this part.
This part right here.
Just little part. Okay.
Semispinalis. Next to it is the splenius capitis. No, this is this part right here.
Oh, not include this.
No,
just
this part right here. And now, depends on your teacher. This or this, depends on your teacher, could be the splenius cervicis. So make sure you ask your teacher. So semispinalis, splenius capitis, splenius cervicis, depends on your teacher. And then levator scapulae. And after the levator scapulae, these three, 1, 2, 3, will be the scalene muscles. If this is specific, this will be posterior scalene, intermediate scalene, and anterior scalene. Good? And now this one that's coming from the mastoid to the sternum and the clavicle will be the sternocleidomastoid.
So
all of this.
The two of this, right?
Yeah, both.
Okay.
Sternocleidomastoid, right? Then after the sternocleidomastoid, if you remember the hyoid bone, and below the hyoid, we have the sternum over the chest.
Yes.
Now the one that's connect the hyoid to the sternum will be the sternohyoid. And under the sternohyoid, the one that goes to the under this, you should have the thyrohyoid. It's under this.
So it's this one.
Yeah, could be part of it is this one. Thyroid.
Oh, you mean like this part, right?
Yeah, so this should be goes to the thyroid gland.
Okay.
So thyrohyoid, that's part of it. And then under the chin, we have the mylohyoid.
This part.
This part right here.
Okay.
Mylohyoid, good.
Good.
And then, and now, let's go over this now. If you remember the scapula, and this is the spine of the scapula. On top of the spine will be the supraspinatus, infraspinatus, and then after that is the teres minor, and then teres major. Teres minor, teres major. And then now, medial to the scapula, we have these two muscles. Now you see how one is bigger than the other one? The big one will be the womboideus major, and the small one will be the womboideus minor. Good? And now, same thing on this side. Remember, this is your trapezius, right? And now, this is the spine of the scapula for both sides. And now, below the spine of the scapula, remember we have what? Infraspinatus. So this is part of the infraspinatus right here.
This one?
Yes.
Oh, okay.
And now, after the infraspinatus, if you go to the medial side, you see what?
The
Womboideus major. So from this, if you go to the medial side too, this is part of the womboideus major.
this is the
Part of the muscle, womboideus major. And now, after the infraspinatus, again, remember we have the teres minor. So same thing, infraspinatus, teres minor. And then after the teres minor, we have the teres major, same thing. Teres minor and then teres major.
teres minor,
Teres major. Infraspinatus, womboideus major. Now, below on the lower back, all of this will be the latissimus dorsi. Good? Latissimus dorsi. And now for the chest area, for the chest, and now, so from this, we have the psoas major. And over the ilium, remember the ilium? So this will be the iliacus muscle. So psoas major, iliacus, same thing. Psoas major, iliacus. Now when the psoas major and the iliacus combine, they form this muscle called the iliopsoas. Iliopsoas. And then same thing, right? Iliopsoas. And then this long one that goes from lateral to medial will be the sartorius. Okay? And then from the iliopsoas, if you go towards the medial side, we have the pectineus.
It's like this part.
This part, right, on both sides. Pectineus. And then after the pectineus, this part will be the part of the adductor longus. And then you can also see this one called the rectus femoris.
So this two part, right?
Yes,
Okay.
rectus femoris. And this one will be part of the tensor fasciae latae. And let me turn this for the back. For the butt muscles, we have the gluteus maximus. And under the gluteus maximus, we have the gluteus medius. And
So it's like this part.
this part right here, medius.
Oh, this part, right? Okay.
And inside of the medius, there's a gluteus minimus.
Yes, minimum.
So gluteus maximus, gluteus medius, and inside is the gluteus minimus. And that's the only thing you can see from
How
this.
about,
These
like-
we don't have to know.
Oh, we don't have to know. So, and this one, we don't know?
Yeah, this you don't have to know these.
Oh, okay.
For the chest, we have the pectoralis major.
So it's like this part.
This part right here, that's covering the chest. Pectoralis major. Now, once you cut the pectoralis major, so this is part of it again for this side. They just cut it to show you the deep muscle. Under the pectoralis major, we have the pectoralis minor. Pectoralis major, pectoralis minor. And now, you see how this muscle is sitting on top of the ribs? Covering the ribs. This muscle on top of the ribs would be the serratus anterior, all of this. Serratus anterior. Good. Serratus anterior. Now in between the ribs, we have the intercostal muscles. Now for this you go by the striations. Now you see how these striations go in like this? This will be your internal intercostals. And this will be your external intercostal. Internal, external intercostal. Good. And then after that, for the six packs, we have this called the rectus abdominis. And on the side of the rectus abdominis, these will be your internal oblique, and these will be your external oblique. So you see the striation is different, right?
Yeah.
So internal will be these, and then external will be like this.
So what's this part?
This will be still, bye, take care. This will be still the serratus anterior. Remember the ribs?
Oh, sorry.
Serratus anterior covering the ribs, right? So, and then rectus abdominis, external oblique, and then internal oblique. And now this also is still part of the rectus abdominis, these two from the back. Rectus abdominis. And the deepest one on the abdomen, you see the striation that goes across like this? So this will be your transversus abdominis. And on top of the transversus abdominis, this part will be the diaphragm. Good. And now from the inside, between the ribs,
So what's this?
this we don't have to know.
Oh, we don't have
So the diaphragm. Now between the ribs, from the inside, all of these will be the internal intercostal. Good. That's it. Of the bones. So this will be the clavicle. The bone, right? The clavicle, and from the clavicle we have the pectoralis major. And on the shoulder we have the deltoid muscle. All of this with the deltoid. And behind this part will be the scapula. So if you remember the spine of the scapula, on top of the spine we have the supraspinatus. And below the spine will be the infraspinatus, which is all of this right here. Infraspinatus.
So those three.
Those three, right? Infraspinatus. And this part that's covered the supraspinatus will be the part of the trapezius muscle. Now after the infraspinatus, we have the teres minor. And this one will be the teres major. The anterior part of the scapula, all of this, will be the subscapularis. And this part will be still part of the pectoralis major from the front. And then in front of the pectoralis major, this one that goes all the way to the lower back will be the latissimus dorsi. That's part of it, latissimus dorsi. And for the arms, so look for the front and back. So in front we have the biceps brachii. And behind we have the triceps brachii, the three heads. 1, 2, 3. So if they point to this, or this, it's gonna be triceps brachii.
Okay, so those three are the...
Triceps brachii. And in front is the biceps brachii, right? Now between the biceps and the triceps, we have the brachialis. Is this one. And if you follow the brachialis down, the next muscle that touches the brachialis will be this one. That goes over the radius. So the name for this will be the brachioradialis. And for this part, this is gonna be your flexor, the anterior part, and the back will be the extensors. Now for the flexors, just remember the thumb is gonna be radius, because remember on the thumb side we have the radius, and the pinky side will be the ulnaris, because that's where you have the ulna, right? So since this is the flexor side, if you follow this leads you to the thumb, and this is done on the flexor side, so this is gonna be your flexor carpi, because it's towards your carpus, and it leads you to the radius. So the name for this is the flexor carpi radialis. And this one, if you follow this leads you to the palm of the hand. So the name for this will be the palmaris longus. Right? And this one, if you follow it, leads you to the pinky. So the name for this will be your flexor carpi ulnaris. Got it? Now between the flexor carpi radialis and the brachioradialis, we have this one called the ponator teres. And under the brachioradialis, under this, we have the supinator. Ponator teres, supinator is under. And this is the brachioradialis that's covering the supinator. Now, we say the back side will be the extensors, right? This is your extensors. So, next to the brachioradialis, these two, 1, 2. These two will be your extensor carpi radialis, because this leads you to the thumb, right? Extensor carpi radialis. And this one that extends to the fingers in the middle, this will be your extensor digitorum. This one in the middle. And next to it, this one goes to the pinky, right? Remember the pinky is ulnaris, and this is the extensor side. So the name for this will be your extensor carpi ulnaris. Good. And now for the exam, if they point to any muscle on the back of the hand, this will be interossi, and any muscle on the palm of the hand for the exam will be lumbrical. And that's it. For the shoulder muscle, we have the deltoid, all of this. And now from the shoulder, if you go on the anterior side, we have the clavicle bone, right? So if you follow from the clavicle bone, we have the chest muscle, right? So the chest muscle will be the pectoralis major. That's part of it. So on the exam, if they point to this, that's part of the pectoralis major. Now on the back, remember we have the scapula. So this is the spine of the scapula. The muscle on top of the spine will be supraspinatus muscle, and then below the spine will be infraspinatus. Now there should be another one that's covering it, so this is part of it. That's supposed to cover the supra and the infraspinatus.
Spinatus, all of this?
It's only this
Oh.
part right here.
This is not?
Yeah, all of this. Infraspinatus.
Infraspinaris.
Right? And then this one that's supposed to cover it will be the trapezius.
Trapezius.
So we have. So once you see the spine,
Yes.
the muscle on top of the spine is like superior,
Yes.
supraspinatus.
Supraspinaris.
Below the spine, infraspinatus.
Infraspinaris.
And then the one that's covering it will be the trapezius.
Trapezius.
Now after the infraspinatus, so this is your infraspinatus, right? So next to it is the teres minor,
Teres minor.
and this one will be the teres major. Now the anterior part of it, we have the subscapularis, so it's under the scapula, so subscapularis. And then on top is still part of the teres major. It's the same thing from this view. Now in front of the teres major, this muscle extends to your lower back to form a large muscle. That's the beginning of the latissimus dorsi. That's part of it. So subscapularis, teres major, good. And then latissimus dorsi, right? Good. And now, remember, pectoralis major.
This,
Part of it.
and I mean this.
Part of the pectoralis major.
Okay.
All of this, right? So just find the clavicle. So when the clavicle is, you have your chest. So this is gonna be your pectoralis major for the chest. And then now for the arms. So once you find which one, trying to find which one is anterior, which one is posterior. So if you, this is your anterior side. So on the anterior side we have the biceps brachii, right? And on the back we have 3 heads. 1, 2, 3. There's gonna be your triceps brachii.
So this is
1, 2, 3.
Triceps
one?
brachii.
So 1, 2,
And 3 on top.
triceps brachii, right?
All
So
three
on
of
the
them.
exam they point to this, triceps brachii, triceps brachii, triceps brachii, right? Now
And what is this?
this is just tendon,
Okay.
the right part, right? Now in the middle, on the lateral side, between the biceps and the triceps, we have the brachialis. So biceps is in the front, biceps brachii. Triceps brachii in the back. 1, 2, 3. And in between the triceps and the biceps, brachialis, right?
Brachialis.
Now if you follow the brachialis all the way up, so remember the thumb, we have the radius on the thumb side, right? The radius. So follow this. The next muscle that touches it, it will be the brachio. Since it's go over the radius, it's gonna be the brachioradialis. So brachialis, brachioradialis, because this one is radialis because it goes over the radius. Brachioradialis. And then brachio because it's like next to the brachialis. So brachialis, brachioradialis goes over the radius, right? Now on this side, so if I tell you to flex your arm, you will go like this, right? When you flex, so anything with flexor will be on this side. So if I tell you to extend your arm, you go like this. Extensor will be in the back. So if you follow this, anything that goes towards the thumb, on the thumb side we have the radius, right? So the thumb side will be radialis.
Yes.
Pinky side will be ulnaris, because you have the ulna,
The
right?
ulna, yes.
So let's follow this muscle, right? So this is the muscle, just follow the tendon. So the tendon leads you to the thumb, right? So the name of the muscle will be the flexor, because it's on the flexor side.
Yes.
Carpi, because it's towards the carpus. And then radialis, because it leads you to the thumb.
So flexor,
Flexor,
carpi,
carpi,
radialis.
radialis. That's the name of it.
Uh-huh.
So name this muscle, flexor, carpi, radialis. Now next to it, this one, if you follow it, leads you to the palm of the hand, right? So this one will be, palmaris longus. So just follow where it leads you. So if it leads you to the palm of the hand, palmaris longus. Just follow this, leads you to the thumb. It's on the flexor side, flexor, carpi, radialis. Now this one is still on the flexor side, but leads you to the pinky. So flexor, carpi, ulnaris, pinky, right? And now between the brachioradialis and the flexor carpi radialis, we have this one called the supinator.
Supinator.
No, sorry, ponator teres.
Ponator teres.
Ponator teres. Ponator teres. And under the brachioradialis, we have the supinator.
Okay.
It's under the brachioradialis. Supinator, under brachioradialis. So ponator teres, and under the brachioradialis is the supinator, right? And then now on the back, we have your extensors now, right?
Yes.
So just follow these two. These two is the same thing. So just follow it, leads you where? Towards the thumb, right?
The thumb, yes.
So this is gonna be your extensor, carpi, radialis.
Oh.
Got it? And then this one leads you to the fingers right in the middle. Take up the fingers as digits.
Yes.
This is gonna be your extensor digitorum. And this one still on the extensor side and leads you to the pinky, extensor carpi, ulnaris. Now to tell the difference between these two, just look at the bone. So this is the ulna, right? If it's
Yes.
like behind the ulna, it's on the extensor side. If it's in front of it, it's on the flexor side.
Oh,
So this one will be the flexor carpi ulnaris, extensor carpi ulnaris. And any muscle on the back of the head will be the interossi, anything on the back. And any muscle on the palm of the hand will be the lumbricals. And that's it.
That's it?
Remember at the bottom we have two bones, right? The tibia on the medial side and then the fibula is on the lateral side, right? Now over the tibia, so this is the tibia bone. Over the tibia we have the tibialis anterior muscle. You're welcome. Tibialis anterior, right? And next to the tibialis anterior it will be the extensor digitorum longus. Extensor digitorum longus. Now on the lateral side we have the fibula. Over the fibula we have the fibularis longus. Is this one. And under the fibularis longus we have the fibularis brevis. Fibularis longus and then fibularis brevis. Now on the back we have the gastrocnemius. And under the gastrocnemius we have the soleus. Gastrocnemius, soleus. And then now the tendon that's connecting the muscles to the calcaneus bone will be the calcaneal tendon. Good. And now behind the tibia we have the flexor digitorum longus. Behind the tibia, good. And now for this part of the legs in front, we have the rectus femoris over the femur. And just remember the rectus femoris is between two vastus. On the medial side is the vastus medialis. and lateral side is the vastus lateralis. And if I take out this, under it is the vastus intermedius. Right? So vastus medialis on the medial side, vastus lateralis, and on inside is the vastus intermedius. Now over the vastus intermedius will be the rectus femoris. Good. Now over the vastus lateralis we have the tensor fasciae latae. Tensor fasciae latae is this one. Now for this area, the long one that go from lateral to medial will be the sartorius. All of this, sartorius. And if you remember the ilium from the bone, over the ilium we have the iliacus muscle. And next to the iliacus we have the psoas major. And when the iliacus, remember we said that when the iliacus combine with the psoas major, they form the iliopsoas. Good. Next to the pubis we have the pectineus. And after the pectineus we have the adductor longus, and this will be the gracilis. After the gracilis we have the adductor magnus.
Like including this part.
Yeah. So gracilis is between two adductors. Adductor longus is in the front, and adductor magnus is in the back. Now, all the way in the back, for the butt muscles, it's called the gluteus. Remember? So the gluteus, the first layer, the most superficial one will be the gluteus maximus, and under it, you can see part of it from this side will be the gluteus medius. And inside of the gluteus medius will be the gluteus minimus. Good. And now below the gluteus maximus, on the lateral side, we have the biceps femoris on the lateral side, and medial to the biceps femoris. Medial to the biceps femoris, we have the two semitendinosus will be on top. And under it will be the semimembranosus. So semitendinosus on top, and then semimembranosus below it. Got it? And that's it.
Do we know the
No, you don't have to know this.